Hi, my name is Renee Van Staveren. I work with hundreds of local Medicare agents across the nation, and I lead Medicare education at Connie Health. In this beginner's video, we'll answer the question, what is Medicare Part B? And we'll review Medicare Part B's coverage, costs, and how to enroll. So let's get right to it. What is Medicare Part B? Medicare Part B is part of the United States federal health insurance program, often called Original Medicare. And Medicare Part B is often referred to as medical insurance. To be eligible for Medicare Part B, you need to meet one of three criteria. The first option is to be age 65 or older. The second is to be younger than 65, but have an approved Social Security Administration disability. And the third is that you would either have end-stage renal disease or ALS. Now that we've talked about eligibility, let's jump into coverage. Medicare Part B is your federal medical insurance. Part B covers services that are medically necessary and delivered by a Medicare-assigned provider in a Medicare-approved facility. This is really critical because if you happen to have services delivered by a provider who is not Medicare assigned or in a facility that is not Medicare approved, you could end up paying out of pocket for the entire bill of all of those services. So as a precaution, make sure you always reach out to ask the provider or the facility if they're a Medicare assigned provider or a Medicare approved facility. Part B medical insurance covers the following: specialists like orthopedic, radiology, cardiology, and more; mental health services, screenings for common medical conditions, preventative care including annual wellness checkups, many common vaccinations, clinical research, ambulance services, durable medical equipment or DME, and limited outpatient prescription medications. There are many tests, items, and services that Medicare Part B does not cover. So it's really critical that you ask your provider or where you're receiving care whether or not the products or items or services that you'll be receiving are covered by Medicare. If you don't, you could be paying out of pocket. Also, you should know that many routine services like routine dental, vision, and hearing are not covered by Medicare Part B. Again, we recommend that prior to receiving any service or procedure, you ask your Medicare provider if it's covered by Medicare. If not, you may be paying out of pocket. Speaking of paying out of pocket, let's talk about the costs of Medicare Part B. The first cost is the premium. Most people pay a premium for Medicare Part B. The Centers for Medicare and Medicaid Services sets the base monthly premium annually, and traditionally you can expect an annual increase to your premium. Now, while the base premium is set by the Centers for Medicare and Medicaid Services, you should also know that some people also pay more than the base premium. I truly hope that you're finding this video to be valuable. If you are, take a moment and hit the like button below and watch this video till the end, where I'll share more helpful links to support you on your Medicare journey. Now, let's get back to the video. Your Medicare Part B premium could be higher because of something called IRMA. The Centers for Medicare and Medicaid Services set certain income thresholds. If you exceed those thresholds, then you'll pay an IRMA, or what's called an income-related monthly adjustment amount. Your IRMA will be based on your modified adjusted gross income as reported on your taxes from 2 years prior. I know this is a lot of information, and there's a whole table to show you about how your income thresholds and your modified adjusted gross income can impact your Medicare Part B premium. Just know that IRMA is extra charge beneficiaries pay in addition to the standard premium. We've linked an article in the description below that shares this year's standard base premium amount and the premium you might expect to pay if you're impacted by IRMA. To see those amounts and that table, click the link in the description below. Now, there can be some good news when it comes to IRMA because you can appeal it. If you disagree with your IRMA adjustment, you have 3 reasons why you can dispute it. The first reason is that your tax amount was inaccurate. The second is that your tax amount was out of date. And the third is for a life-changing event. There are 7 life-changing events that could qualify you for an IRMA readjustment. These include death of a spouse or marriage, divorce or annulment, work reduction or stoppage, the loss of income from an income-producing property, or the loss or reduction of certain pension incomes. If you see that your taxes are not accurate, they're out of date, or you face one of these 7 life-changing events, there are steps that you can take. If you'd like to appeal your IRMA, you can write a request for appeal by mail, or you can call your local Social Security office. If you're looking for a way to reduce your Medicare Part B premium and you're low income and meet certain criteria, you may qualify for a Medicare Savings Program. Now let's move on to deductibles and coinsurance. Medicare Part B has an annual deductible that changes yearly. And every year that you're enrolled in Medicare Part B, you must pay your Medicare Part B deductible prior to Medicare covering any of your services. Almost any item or service that Medicare Part B covers applies to your Medicare Part B deductible. Part B also has coinsurance. After your Medicare Part B premium is met, you pay a 20% coinsurance on all Medicare-approved doctor services, outpatient therapies, and durable medical equipment. If you'd like to learn more about this year's Medicare Part B deductible and coinsurance amounts, there's an article linked in the description below. Now let's talk about how to sign up for Medicare Part B. There are 2 camps of people when it comes to Medicare Part B enrollment. There is a group that will be automatically enrolled, and then there's a group that will have to take some steps in order to enroll in Part B. So the question is, will you be enrolled in Medicare Part B automatically? The answer is maybe. So if you're already receiving Social Security retirement benefits when you turn 65, you'll automatically be enrolled in Medicare Part B and A. And your coverage will start on the first day of the month you turn 65. For example, if your birthday is June 21st and you're already receiving Social Security retirement benefits, then your Medicare Part A and B would start on June 1st. Now, if you're younger than 65 and you have an approved Social Security disability and you've been receiving disability benefits for 24 months, then you would also be automatically enrolled in Medicare Part B and A. And if you have end-stage renal disease or ALS, then you'll automatically be enrolled in Medicare Part B and A the first month that your disability benefits start. So as a recap, if you're 65 and receiving Social Security retirement benefits, you can plan to be automatically enrolled in Medicare Part B and A when you turn 65. And if you're receiving some kind of disability benefit, you'll likely also be automatically enrolled in Part B. Now, what if you're not automatically enrolled? This might be, for example, someone who is 65 years old and decides not to take Social Security retirement benefits. Instead, you continue to work. There are many cases where you can turn down Medicare Part B enrollment or delay it. Just keep in mind that if you decide to enroll later, your enrollment could be delayed. You may pay a late enrollment penalty if you decide to delay Medicare Part B enrollment and you don't have credible coverage during that time. Now, this is really critical. I'm going to share with you how to avoid a Medicare Part B penalty because these are lifetime penalties. If you don't enroll in Medicare Part B when you first become eligible, you could pay a 10% late enrollment penalty for every year that you delayed enrollment and didn't have credible coverage. For example, if you're now 68 years old and you should have enrolled when you're 65 and you never had credible coverage during that time period, then you're 3 years late to enroll in Medicare Part B and you'll face an enrollment penalty. For each year that you delay or you're not enrolled when you should be, that's a 10% late enrollment penalty. By delaying coverage for 3 years, you'll now have a 30% late enrollment penalty for as long as you have Medicare Part B. That's 10% times 3 years. Now, how does that affect your pocketbook? If your premium was $100 originally, it'll now be $130 per month. That's an extra $360 per year. And for example, if you're enrolled in Medicare Part B until you're 77 years old, you would have paid an extra $3,420 in late enrollment penalties. The critical time period that you need to keep in mind to ensure you avoid late enrollment penalties is your 65th birthday and your initial enrollment period. Your initial enrollment period is unique to you. It's the 3 months prior to your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. It's a total of 7 months. If you're 65 and you're not automatically enrolling in Part B and Part A, and you're continuing to work, we really recommend that you speak with your employer and that you contact the Social Security Administration to ensure that you can delay your Medicare Part B enrollment without any late enrollment penalties. Once you're enrolled in Medicare Part B, call and speak to a local licensed Connie Health agent. A local agent can help you review your plan options to protect you from high out-of-pocket costs and get you the benefits you want and need. Connie Health has written 2 articles about Medicare Part B that really pertain to your new to Medicare journey. One is about Medicare Part B coverage and how to enroll, and the other is all about Medicare Part B's costs. Links to both of these articles are listed in the description below. In this video, we answered what is Medicare Part B, and we reviewed Medicare Part B's coverage, costs, and how to enroll. If you like this video, hit the like button. And if you'd like more videos like this, subscribe to our channel. For more Medicare videos for beginners, click the video links in the description below. Until next time.